A down athlete, okay, in football equipment, what we want to do is we want to come in and maintain stabilization right away. Our main priorities are cervical spine stabilization and circulation, airway, and breathing. Once we have that established, then we can do other things with the athlete as we deem fit in our evaluation. As you see right now, we are coming in and we are trying to do the trap hold, where we come in, the forearms are along the helmet, and the hands are kind of getting the trap so that we're stabilizing that patient. At this point in time, we would do our getting the airway exposed. All right, so a couple of things. This helmet has a quick release and 2 clips. All we need to do is release these 2 if we're gonna remove all the equipment. If we're removing just the face mask, okay, we need to remove all 4 if we're keeping the rest of the shoulder pads and helmet in place. So all based on your protocols. When we have the quick release, okay, we have it here. I'm gonna come in, push on the pin, and that's released. Do the same thing on the other side, and now our helmet can flip up. We now have our airway, and we can go in from there on how we're gonna do it, if we're gonna remove the equipment or if we're gonna take the face mask off. We'll go with taking the face mask off for now. So again, we can use your Phillips screwdriver, okay, on a reverse. Remember, a low torque Phillips is recommended. Okay, so that's released. Or we have the cutting method, which again, you can have different pruning clips coming in and cutting straight across to release the entire helmet side edge. Okay. And now here we have the helmet off, and now we can remove that face mask all the way. This should be done in less than a minute. And now that face mask is off. Okay, so the face mask is removed. We are now going to go with the technique of removing all the equipment. We're going to use the T technique, coming down, cutting the jersey, and then across the shoulders. These shears are not. And then this one. Okay. We would then cut down our shoulder pads and cut any of our side straps as needed. Once we are in this position, we are then going to cut the chin strap as well, but for demonstration purposes, we're just going to pop the clips. So that would have been cut off. So now we have the chest exposed, the airway is exposed as well. Now we're gonna get ready to transfer care. So Megan's gonna come in and hold more of an anterior posterior. Come under the shoulder pads. And using your forearm on the chest to stabilize. Once she has care, she'll transfer to Roger. Now Roger, okay, is gonna do on Megan's count. All right, he's going to remove the helmet only, and then we'll come back in, and Roger's going to grab the other shoulder pad and we're going to remove that. So go ahead, Meg.
Okay, Roger, 1, 2, 3, 4.
Good. She's going to hold it up. Now Roger's going to come grab that shoulder blade. Okay, underneath it a little bit. Okay, on Megan's count.
Ready? 1, 2, 3.
Good. And those are now out. Okay. Now from here, Roger's going to take over stabilization. Got it. So once we have an athlete that the equipment has removed, or you have an athlete that is not wearing equipment to begin with, we're going to do semi-mobilization with a collar. Collar can be adjusted with the tabs. Okay, pushing out, and then slid up and down, and then locked back into place. We measure the back of our hand, clavicle to jawline, and we measure along the collar. You're gonna come in from the chest, up under the chin, sliding. Roger's gonna nicely, gently slide his hand one way, fish it out on this side, and then put his hand back. He's gonna stabilize that way, and now our collar is in place. Now we have the athlete's equipment removed. We have a cervical collar on. We are now going to log roll this athlete onto a spine board, okay, for transferring to a stretcher and to the ED department, okay? So we have one person at the mid-torso, one person at the heads, and we would have a third person down at the legs. We're gonna crisscross hands at the top, so I'm gonna grab his waist here and his shoulders. Andrew's gonna crisscross with me, okay? Meg is gonna have to dress the board and bring it close to us. Everything's gonna be on Roger's count. We're gonna go on 1, 2, 3, and then roll, okay?
Okay, on my count. 1, 2, 3, roll.
Okay, board in,
Help us out with that.
and in, all right, and down on
And
Roger's
1,
count.
2, 3, roll.
Okay. Good. We're gonna adjust him now. So Meg's gonna grab waist, you're gonna grab legs. You just grab both
On
sides
my
of the leg.
count.
I'm gonna go down and then up.
1, 2, 3, down. 1, 2, 3, up.
Good. Now from here, we're going to secure him in. The head's the last thing to be secured. Okay, we're gonna use the straps to crisscross. Remember, we wanna leave the arms semi-exposed so that we can do our vitals and IVs. Go over the shoulder. All straps should be snug. Right over the top. And the headlocks. Okay. We apply one at a time. So Roger can move out of the way. There we go. We'd have 2 pieces of tape. One goes over the top and Velcro down. The other one will go across the chin. And then at that moment, we can release stabilization and move this person to a stretcher. So with the scoop stretcher, it's another way that we can transfer an athlete to the stretcher. It's nice and easy, quick. Obviously for our wider athletes, it may not be the tool of choice. So again, based on your EAP. We would start with measuring it from head to toe. We release the tabs at the bottom. The narrower part is for the feet. Slide it till it locks in to the next spot. Okay, now we have the length that we need. All right, we have push pins on each side that release it. And what we would do is we would come in from the side, okay, and pretty much literally scoop the athlete up. We'll start at the bottom, work our way up. So that locks in there. I'm gonna gain stabilization for Roger so we can lock in the top. I have cervical stabilization. Just gonna, good. And now the athlete is secured in the scoop stretcher and we can lift and maneuver him to the stretcher that way.